Bro, I'm stressed. I just filled my bio paper.
You need some? Actually, Kamil, I have something better.
What is this, man?
You know what?
What is this, bro?
Trust me. Let me show you how.
You sure about this, bro?
Yes, bro, just take it.
What are you guys doing? You guys do drugs? And even shed needles? Don't you guys know you can get HIV because of this?
What? Huh?
Do you guys know what is HIV? If no, let me show you.
HIV, or its full scientific name, is human immunodeficiency virus. HIV is an infection that attacks the body's immune system. Meanwhile, AIDS, or its full scientific name, is acquired immunodeficiency syndrome, is the advanced stage of the disease. In human body, HIV target the body's white blood cells, weakening the immune system that make it easier to get sick with diseases like tuberculosis, infections, and some cancers. Untreated HIV can progress to AIDS after many years. HIV can be spread from blood, breast milk, semen, and vaginal fluids.
However, people tend to confuse between HIV and AIDS. So, what are the differences between HIV and AIDS?
What makes the difference between HIV and AIDS are HIV is a virus that weakens your immune system, while AIDS is a condition that can happen as a result of an HIV infection when your immune system is severely weakened. So, you can get AIDS if you are infected with HIV.
Now, how does HIV and AIDS are first discovered? During the early 1930s, it is believed that HIV-1, the most common form of the virus, spread from chimpanzees to humans, most likely during bushmeat trading. Hunters would have come into contact with animal blood while hunting chimpanzees, probably in and around Cameroon. In 1981, in the US, reporting of unusual high rates of the rare forms of pneumonia and cancer in young gay men begins. The disease is initially called gay-related immune deficiency, GRID, because it is thought it only affects gay men. Cases are also reported in injection drug users by the end of the year. Next, in 1982, the disease is renamed as Acquired Immune Deficiency Syndrome, or AIDS. Canada reports its first case of AIDS in March. It is realized that the infection can be sexually transmitted and caused by HIV. Cases are reported in blood transfusion recipients. Last but not least, in 1986, it is discovered that women can become infected with AIDS during heterosexual sex. Then they also discovered that HIV can be passed from mother to child through breastfeeding.
So, how does HIV and AIDS can be spread? HIV can be spread through sexual contact, use of shed needles, contact with infected blood, or inherited by child from their parent who are infected with HIV and AIDS. So now, let us look at the numbers because numbers don't lie.
At the end of 2021, around 81,942 people were living with HIV in Malaysia. Out of them, 67,822 knew their status through national surveillance. About 66% of reported cases were receiving treatment. New HIV infections dropped by 70.2% from 2002 to 2021. In 2021, there were 2,760 new cases reported, equivalent to 8.5 cases per 100,000 people. The HIV incidence rate per 1,000 uninfected population declined from 0.3 to 0.19 between 1990 to 2021.
Now, let's compare statistics of HIV cases by gender as of the latest update in 2022. Majority HIV cases reported, about 90% are infected by males, while other 10% is infected by females, which leads to the ratio of 9 males to 1 female.
Okay guys, this is the important part. So, stay lit. Sign and symptoms. Victims who are infected for the first few weeks will get symptoms of influenza-like illness such as fever, headaches, rashes, and sore throats. After the infection weakens the immune system, the victims will get swollen lymph nodes in their body, weight loss, cough, and diarrhea. If this handled without a treatment, it can develop into the other illnesses. For instance, tuberculosis, cryptococcal meningitis, severe bacterial infection, and cancer such as lymphomas and Kaposi's sarcoma. There is no cure for this disease, but there is a treatment for those who are infected of HIV and AIDS. Antiretroviral therapy. ART is one of the treatment for HIV. ART involves taking a combination of HIV medicine called an HIV treatment regimen every day. Antiretroviral medicine works by stopping the virus replicating in the body, allows the immune system to repair itself and prevent further damage. A combination of HIV drugs is used because HIV can quickly adapt and become resistant. Short reminder, ART cannot cure HIV, but HIV medicine help people with HIV live longer and healthier lives.
There's no prevention to HIV infection and even no cure to this deadly disease. But you can protect yourself and others from infection. These are some of the precautions that you can take if you think you are at risk of having HIV infection. They can consider taking pre-exposure prophylaxis, also called PrEP. This PrEP medicine can be taken by both sex workers and drug users because it can reduce the risk of getting HIV from sex by about 99% and from injecting drugs by at least 74% according to the Centers for Disease Control and Prevention. Among sex workers, they are advised to use new condoms during sexual intercourse. This can help to prevent the spread of blood-borne viruses, sexually transmitted infections, in this case HIV, and also help to reduce the number of unintended pregnancies. Next is that they can consider doing male circumcision. Among drug users, they need to use clean and sterile needles. In order to do that, they can find an needles and shrink exchange program near them so that they can reduce the cost of getting new shrinks at the pharmacies. Also, they can decide not to inject drugs. This also could benefit them from getting addicted and getting serious about taking drugs.
Can HIV or AIDS be spread from oral sex? The risk of HIV and AIDS be spread from oral sex will rise if the semen or vaginal fluid of the infected person is enter the mouth cavity of their sex partner. However, currently, there are no reported cases involving oral sex regarding HIV and AIDS.
Next question. Can HIV virus live outside the human body? The answer is no. HIV virus cannot live outside the human body for long due to high temperature and dry surrounding. It is also can caused by soap or any other disinfectants.
Where can I get a test for HIV? Don't worry guys, you guys can go to the nearest hospital or any health clinic available around you. The result will be kept by the health officer for the further treatment.
Can someone be infected with HIV during blood donation process? The answer is no. This is because all of the equipments and needles that are used for this procedure are sterilized and clean. But if you know that you're having HIV infection, please do not donate blood.
That's all from us. Thank you for watching.